Blood pressure is the amount of force in which your blood used to flow through your arteries. Okay, so it's very important. So imagine that we have an artery right here, okay, or a vein or something, right? And we have a bunch of oxygen. And so what blood pressure measures is the pressure that is exerted on the arterial wall. Okay. Now, sometimes they denote arteries as being um, red. However, it's not about oxygenated or deoxygenated blood. It's about if it's going away or to the heart. Okay, so we know that arteries go away from the heart. Okay, such as the aorta, which is the largest artery that we have, goes away from the heart to the rest of the body. Now, it's very important to note that there's also the heartbeat, right? So heart pumps blood 60 to 80 times per minute over the 24 hours per day, and the arteries deliver oxygen and nutrients to your whole body, and that's used to its function. The highest blood levels in the heart and decreases right away. So we're talking about the systolic and diastolic blood pressure, right? So we have the systolic and we have the diastolic blood pressure. And so what does those mean? So the systolic blood pressure is the pressure when the heart beats, and the diastolic is when the heart relaxes. Okay, so this number is higher than this number. Okay, so normally it's going to be 20 over 80. All right, so 20 representing the diastolic blood pressure and heart pumps, so we have greater pressure, and then when it relaxes, so that's the diastolic, so that means we have a less pressure. Okay, and this is measured in millimeters of mercury, millimeters of mercury. Okay, now important. So what factors can affect blood pressure? Now we know it's age, medications that individuals take. For example, diuretics can decrease blood pressures. Okay, and then we have change in position as well has been researched. So for example, we can say about the supine position, the standing position, or the sitting position. Okay, or the seated position. Now the seated position is the one that's normally used, right? So when you think about clinical settings, you think about the sitting position when individual sits, right? They are in a chair, usually, right? So they sit right up in a chair, their back is supported, and that's where they take the blood pressure. It's important that their hand is heart level, right? Or the cuff that's been placed is heart level. And so this is important for the most accurate measurements. Now, of course, the WHO and the American Heart Association say that you can also take blood pressure accurately in the supine and the standing position. However, the most important thing is that the cuff is at heart level. Okay, at heart level. Now this is important. What else? Here we can also say that we have heart rate. So heart rate represents beats per minute. So we got beats per minute. And so what does that mean? That means that how much your heart goes or beats or pumps per minute. Okay. So usually, so for athletes, it is low. So you want it to be as low as possible. That means your heart is rested. Okay. So for athletes, we're looking at 50, for example, or maybe 45. Okay. Normally, it can fluctuate between 60 to 80. High cases maybe 100 to 120, and we have an activated sympathetic nervous system, right? It's number of times your heart beats per minute. Okay, so I hope this was helpful. This is just a quick overview. Let me know if you have any questions about any diseases or things related to cardiovascular data. Next, we will talk about how we can derive those information using baseline for different individuals and how we can use research methods to derive blood pressure and heart rate measurements. Okay, thank you so much. Have a good day.